Dr. Victor Filadora is the president of Great Lakes Cancer Care Collaborative. Thanks for joining us today on Medically Speaking.
Thanks for having me, Mike.
If you can, please, let's start out with those with some chronic health issues and some of the things that we've been seeing across the system. People who are maybe putting off their routine care, whether an oncology patient or not. Tell us what that's been like and why it's so important to follow up in all of their routine screenings, whether that's mammograms, colonoscopies.
Well, we're just beginning to understand COVID-19 specifically. There are a lot of other viruses in the corona family, and in patients that have suppressed immune systems, those viruses often cause more serious illness when their immune systems are low. And, that would be cancer patients who are undergoing treatment. Those patients often have weaker immune systems, and it makes it harder for our bodies to fight illnesses. And so it's very important that cancer patients maintain contact with their cancer doctors, especially if they're in active treatment. But it's very important for them really to monitor their health and contact their cancer doctor through this pandemic, just like they would any other normal time.
So I do want to talk to you a little bit more about that. You're talking about those who are at higher risk. So can you explain for the viewer, for those who may be under current treatment or maybe have recently completed treatment, why they are at a higher risk of getting coronavirus?
Sure. The main principles of cancer treatment is really to slow down cells that are dividing rapidly. And we do that either through chemotherapy or through radiation treatment, or if we can take the tumor out through surgery, we do it that way. And oftentimes when we give you treatments like radiation or chemotherapy, not only does it attack those cells that are rapidly dividing, the cancer cells, but it also has side effects on your body that decrease your immune strength. And it puts you at risk for colds, for other illnesses that you could catch. And so it's really important that, you take care of your body and support your body during this time. So you want to make sure that your vaccines are up to date. You want to make sure that you're getting good sleep so that your stress levels are low and your body can have time to heal and repair itself overnight. You want to make sure that your nutrition is up to date and that you're eating really nutritious foods, and that if you can, you're exercising a little bit. And all those things will really help keep your immune system strong, decrease the level of stress in your body, and really help to try to get you through this time when we really don't know exactly how corona is going to affect all of our cancer patients.
You mentioned stress earlier. Can you tell us how patients are handling the current situation with the coronavirus? We know there's an awful lot of fear in the community about the coronavirus itself, but when you layer in a cancer diagnosis, my guess is that stress level just increases. How are the patients that you guys interact with handling all this?
They're suffering, cancer patients are suffering from some of the same issues like you talked about that we all are, right? Social isolation, emotional support issues. We've restricted hospital systems across the country, and especially locally too, have restricted those who can go with you on treatment. So you're going on an uncharted course for cancer treatment and you can't have a loved one with you. Fear of the unknown in oncology and loss of support kind of overall. But we have a lot of things in place in our system that really can help these patients with these issues. We have nurse navigators. We partner with the Visiting Nurse Association, and these nurse navigators can help address those issues and make sure there's a good support system for our cancer patients. We also give them choices. They can come in for a physical visit, or they can go on a virtual visit, whatever really meets the needs of their situation. So we're trying to put some control back into our cancer patients' lives, because not only has COVID taken control away from them, but also cancer has. But on top of all these shared issues, they have unique concerns. And it's about their treatment plans. And is this disease, in the way that we're treating patients, is it going to affect their outcome? Quite honestly, they're probably asking, is this going to affect my ability to survive cancer because of the way that we're treating people? And I would say that we are looking, just like other cancer centers across the country are, at each individual person, where they are with their disease, and altering their treatment plan so it gives them the best chance of survival, just like if we weren't in the middle of the pandemic.
So, in the sense of comparison to maybe a primary care office or even a clinic, the oncologist offices are really open. I wouldn't say for normal business, but for those who require infusion therapy, radiation treatment, or even surgery, they're still able to receive treatment at this time, correct?
Absolutely. We really haven't stopped for our oncology patients. We've just altered the way that we interact with our patients. But, as they say, cancer doesn't stop, so we can't stop. So you're correct in that.
So, when you talked about some of those modifications, what kind of modifications are we talking about?
Sure. I think in two broad general categories, I would say the first thing that I want to reassure patients is we are following the national guidelines and best practices that every single cancer center across the country. So when we talk about modifying treatments, we're not doing anything locally. We're really following the guidelines that the breast cancer societies are following if you have breast cancer, colon cancer societies if you have colon cancer, and so on. We're in constant contact with up-to-date publications. We are conferencing with our colleagues across the country to make sure that we are doing the same thing that others have, because we're all kind of experiencing this pandemic at the first time together. The second thing I want to say is that we're tailoring those decisions, those modifications, based on each individual person. Because let's say you and I both had prostate cancer, and it was the same stage. I might have a health condition that affects how I'm going to be treated, and you might not have that health condition. And so when we talk about modifying your treatment, what does that mean? It means maybe we can delay your treatment. It won't have any effect on your outcome. Maybe we're going to change the drug you get in chemotherapy to a less toxic drug. And again, that might not affect your outcome. It might just be a change in the regimen. We can change the frequency of treatments. You talked about maybe less frequent or grouping things together. Again, our partnership with the VNA, we could offer home infusions in some instances. And we might offer telemedicine. So even though we modify our approach, it's going to be very different from person to person. And oftentimes cancer patients talk to each other. And I wouldn't want, if two people have the same disease, they might be getting different treatments. And that doesn't mean that they're going to have different outcomes. It means that they're being really tailored to them as a person. And we meet together as a team to talk about this and following our guidelines.
We talked about modifications and changes and making the patient feel comfortable. We really didn't hit on the safety issue. What can a patient or their family member expect when it comes to safety when they walk into one of your facilities or to see one of your providers?
We want to protect our patients firstly, but we also want to protect those that are delivering the care as well. And so you're going to see similar things wherever you go into hospitals. In clinics, I don't think the cancer patient is going to see much different than a non-cancer patient, but there will be, obviously we talk about social distancing and keeping 6-foot distance. So our waiting rooms are going to reflect that. There's going to be more space for people. There's going to be masks involved. There's going to be frequent hand washing, Purell stations. Patients might have to wait in the car if the waiting room is too crowded and we feel that it's going to be unsafe or put people at risk, and you're early for your appointment. We might ask you to wait in your car and call you back out. There's going to be kind of more guidance throughout your visit in where you can go and how you should approach the infusion center and where you can sit and wait and things of that nature. And we really kind of are evaluating that on a weekly basis, again, with our colleagues across the country to make sure that we're kind of doing similar things that they are all over.
So, Doc, as we wrap up, we're obviously in the middle of a public health crisis, a pandemic. But as you said, cancer really doesn't stop, at any time, despite what may be going around. Can you tell us, any type of final message or parting words to those who are watching who may themselves be going through some sort of cancer diagnosis or treatment or have a loved one? What's your message for those who are going through this at this time?
My message for them, I think, is COVID has really created a complex set of management problems for patients with cancer. And not only our patients, but our caregivers, and because of their potential risk that they have with their disease process. And our goal is to protect all participants in healthcare. And it goes together with all those things that I just talked about with you, about the social distancing, the hand washing. knowing that your goals of your treatment plan are going to be reviewed by a team with you, and we're going to make sure that if we modify anything, your treatment plan is going to reflect that. And our goal is to not affect your survival or your outcome, but to partner with you in this and to reassure you with all the things that our entire health system has to support you as you go through this. One of the most important things is going to be communication. As we go through these virtual visits, as we do the social distancing, it's much harder to communicate, and you have to put a lot more thought into how you talk to people, and there's going to be a little fear around it. But if you're having symptoms, if you have any questions, you need to call your cancer doctor because they're there waiting to help figure out this with you and walk you through this. And so don't be afraid if you're having a side effect from a drug, or if you have a symptom that you're not sure of or something is different, just pick up the phone and make a phone call. They can do a virtual visit. They can tell you to go to the emergency room or urgent care. They'll figure out what to do with you so that you really can get the proper treatment.
Dr. Victor Filadora is the president of Great Lakes Cancer Care Collaborative. Doctor, thanks for joining us today on Medically Speaking. Thanks for your message of safety, and thanks for your message of hope. Appreciate you joining us today.
Thanks, Mike.